Ryan Tola here, and Dan Henry as well. We're with Doyle Alliance Group. We are your insurance consultants, and we're going to tell you a little bit about this landmark legislation known as Chapter 44 that was passed in regard to new contribution schedules and new benefit plan offerings that are going to be required to be offered at the district and at every district across the state. We'll start it off just by saying, of course, that what we're about to tell you is our understanding of the law and the way that it's written and how we're going to, and how it should be administered. It's not technically legal advice. Of course, we're going to work with Kate as we go through this, as issues and items come up, as things need to get interpreted, should there be a certain way things have to be done. But at this point, this presentation is really going to go through a little bit of the nuts and bolts of what we're going to have to do here at the district and what you'll be seeing coming out of the administration office over the next couple of months. Okay, Joni, you can go ahead and go to slide 4, actually, if that's okay. All right. So here we go into the legislative updates. Go to slide 5. All right. So first, the law was signed into effect on July 1st of 2020. And the intent of the law was to offer 2 new mandatory health plans and prescription drug plans, and also change the way contributions were going to be collected on participating in the plan, as opposed to the way Chapter 78 was, as percentages of the premium based on your salary. It will now, for these plans, be a percentage of the salary again. Back like when it all first kind of came out in 2008, 2009 with Chapter 2, at that time, obviously, it was only 1.5% of salary, but now we're into a whole new salary table that is meant for these new plans to sort of take over for what the Chapter 78 plans were. The 2 new plans that are going to be introduced are the New Jersey Educators Health Plan for this January 1st, the NJEHP, as you'll see in a lot of these slides, and the Garden State Health Plan. And that's going to be available on July 1st of 2021. So we'll talk about that a little bit more in a minute. For now, we'll kind of stick with talking about the Educators Plan, since that's going to be the first plan coming in. The interesting part about this new plan is a couple of things. One, every new hire that you hire after July 1st, on or after July 1st, is going to be required to stay in this plan and have this be their plan of choice until the Garden State plan comes out, of which they can choose that as well. They will be required to stay in this plan until July 1st of 2028. And one thing I want to really point out about it too is that it's a new hire to you. So it can be someone who's been in the working as a teacher at other districts for the last 10, 20, 30, whatever number of years. It doesn't matter. It's when you hire someone new as a Parsippany employee as of July 1st or later, they're going to be required to participate in this plan should they choose to participate in health insurance. Okay. Go ahead, Joni, you can go to the next slide. Okay, so we already talked about some of these things. The Educators Health Plan must be in effect by January 1st. Okay, the new plan that's going to come out on July 1st, called the Garden State Health Plan, it's going to be the same benefit design as the Educators Plan, and we'll show you that in a minute, but it's going to be a New Jersey only network plan. So those that choose that plan are only going to have in-network coverage for a non-emergent basis in the state of New Jersey. So it'll only be providers within the state. And the idea there is that it's to keep healthcare dollars within the state. That plan is going to have no real out-of-network for care unless it's emergent basis. And the interesting part about that one, though, is that it will be at half the contribution of the Educators Health Plan. So you get a smaller network, same benefit design in network, but you'd pay half for it in relation to the Educators Plan. Once again, that plan will come out for July 1st. So as of this coming January 1st, that won't be offered at this time, but it will be for the next following open enrollment. Okay. We already talked about being in these plans until January 1 of 2028 if you're a new hire. The Educators Plan, and this doesn't necessarily affect you as a district, but just as teachers and staff retire, the Educators Health Plan will be the plan retirees will have to enroll in that are under age 65 if you have the years and the time of service to when you enroll in the state health benefits program. That'll be the plan that you go into until you're age 65, when you would have that, you would have the Aetna Medicare Advantage program. Okay. Last bullet point on this slide to talk about is that all districts must hold an affirmative open enrollment period. And we'll talk about how we're going to do that, but in essence, what that means is all the other employees that were employed at the district prior to July 1st can still stay in the plans that they're in and still pay their Chapter 78 contribution to do so. So all the existing plans will still be there, and they can voluntarily elect to take the educator's plan if they want to, or if they don't want to, they don't have to. The key to this open enrollment is that the law is requiring us to do an active open enrollment, meaning that if you want to stay in your existing program, you do have to actively fill out a form and stay enrolled in that program, okay? So anyone who doesn't fill out the form that's currently in one of the programs that we have in place today, if they ignore the open enrollment period, for lack of a better term, they will automatically be moved into the new educator's health plan. Okay, so part of our open enrollment process is going to include the form that they can fill out electronically. They don't have to print it or anything of that nature. They can fill it out, they can send it back, and it'll go into their personnel file. But each and every person who wants to stay where they are going to have to actively stay enrolled in that plan by filling out that form. The only option during this open enrollment is going to be if you want to stay in the plan that you're in at the enrollment level you're in, or if you want to switch to the educator's health plan at the enrollment level you're in. So this special open enrollment for January 1 is just to make those two choices. For July 1st, when we hold our standard open enrollments, of course, you can make all of your standard changes, adding, dropping dependents, doing whatever you would like to do, or changing plans into one plan or the other plan. That'll be in the regular enrollments we handle and we hold in May and June for July 1st. So this special enrollment for January is simply only to stay where you are or to choose the educator's health plan. For those employees that you hired after July 1st and are in one of your standard plans right now, because this plan isn't offered until January 1, they are going to be automatically switched over into this new plan effective January 1st. Okay, so the new employees that are out there now in your existing program will switch over to the new program come January 1st. Okay, so on slide 8, we'll talk a little bit about what we're going to provide. So during this open enrollment period, the open enrollment period is going to run loosely based on dates. We're still nailing down all the official dates and all the documentation that's going to go out. You're going to see documentation go out in the last week of October. The open enrollment period will be during the month of November. There's going to be a packet of information that's going to be sent out to all of the employees. That's going to include that form that they have to digitally fill out. It's going to include their current health benefit summaries that are the plans that we currently offer today. They're also going to get an FAQ that's going to be included with this that goes through all the different things that kind of we're talking about now. What if I was hired before? Can I elect to go back and forth at open enrollment? All the different questions that a lot of we've seen already, we've put together in a nice 2-page FAQ that we're going to include with that as well. We'll also have the educators' health plan contribution salary table. And furthermore, we're going to have our employee contribution calculator that we've created. We're going to have that posted online where employees just have to put in their salary, put in what benefit elections they're interested in and what plans they're interested in, and it'll show them what their contribution would be for the new plan, what it'll be under their current and existing programs through Chapter 78, how much they would save or what the difference in pricing would be, so that they can make an informed decision on whether or not they're going to want to move into the new plan or stick with what they've got now. Along with this open enrollment, we are going to conduct Zoom meetings similar to the meeting that we have here, and to the degree in-person meetings if the board so chooses to want to hold them in the schools, or if we want to keep it electronic, it's fine for us either way. But we're going to hold these meetings and hold informational sessions with a slideshow similar to what you're looking at now, but a little bit more in detail with more specificity on what the plan choices are for those individuals. And really kind of educate them on what the benefit designs are, the differences in the benefit designs, the nuances that are in the educator's health plan that are very different than your current offerings that I think are very important. That way they can help make an informed decision, and they have the access and the tools to do that by asking us questions about it, by being a part of these Zoom meetings that they'll be invited to. Okay, on the next slide here, you'll see this is a slide that shows what the percentage of salary contributions are. I'm not going to spend a whole lot of time on this other than to say this is what the new schedule is. It's issued by Division of Pensions and Benefits. It's based on where your salary ranks, what percentage you're going to pay, at what enrollment level you choose. The part that's interesting about this is that these are the percentages for medical and RX. So if you're going to elect medical coverage, it'll include prescription drug coverage because you're paying that amount based on your percentage of salary for those enrollment levels anyhow. You're no longer paying a percentage of the premium, to which if you were to eliminate drug coverage, you'd pay less because you're not paying on that piece. In this instance, you're paying a fixed amount for health and prescription drug based on those salaries. The next slide just shows a high-level explanation benefit grid of what the educator's health plan is. Again, I'm not going to go through this line by line, but just to tell you, as a whole, it's a $10 copay for primary care visits, $15 for specialists. Most things in network are covered at 100%. Other items at $15 copay, and prescription drug, which is on the next slide, is going to be covered at $5 generic, $10 brand. And we're going to talk a little bit more about that as well. The two big things that are very different in these programs that are not in your standard programs are going to be a lot of the management utilization control programs that are in place for the prescription drug, and the out-of-network benefit grid having a reimbursement schedule for reasonable and customary charges. Both of these things are done very differently than the current plan. So these are the things we're going to spend a lot of time on educating your staff to make sure they know with this plan, for those that have the option to choose it, that we make sure that they understand what that means when it comes to prescription drug and when it comes to if you're using out-of-network providers. The prescription drug programs that are in place are going to have some prior authorization and some step therapy items. Those are the things that we need to make sure we educate them on that are a little bit different than what you have now. So we'll go through that in detail with them. For the out-of-network allowable charges, I don't want you to think that it's difference in benefits in the sense of co-insurances and deductibles and out-of-pocket maximums. It's more on what the allowance for those benefit provisions to be applied. So without going too far into the weeds on it, the new plan is using what's called 200% of Medicare fee schedule, which is essentially the allowable charges are twice that of what Medicare would pay a doctor, hospital, or provider. So this is a different table than what most out-of-network services are in existing school board plans. And in short, there is a higher potential for individuals to get what's called balanced billing for amounts that are above and beyond the reasonable and customary table. So there's a large piece that we're going to spend a lot of time educating these staff on what that means, so that they know if they're going to go out of network, some of the things that they should do prior to going to ensure what their out-of-pocket cost is going to be. So it's an important nuance to the plan that's different that we want to make sure we outline. At this point, we're going to go ahead and open it up to any questions that you might have. You know, there's a lot of special nuances to this law. A lot of things are just coming out now. We're just now starting to get the rates for it. We're now getting the benefit grids for it, the things that the carriers are able to match and how they have to provide equal to or better than insofar as what the law says. So there were some nuances there that they had to work out. So it's a very living and fluid process right now. Everything is really kind of coming in now, so we'll be prepared for open enrollment in November. We'll have all that documentation ready to send out to the teachers by the last week of October, and we expect a lot of questions. We hope that there is a lot of questions for those that are interested, in the sense that we want to make sure that everyone's educated and can make the right decision for them.
All right, I'm going to start asking with the board members online first. Judy, you have a question?
I do. Thank you for that presentation. I attended the legislative meeting and they gave an overview of the health benefits, but yours was very informative. The one question I have is, I know that new retirees will have to go into this plan. What about people who have retired? Are they grandfathered? I mean, what happens with them?
Our understanding is that all retirees under age 65 will go into this plan effective January 1st.
Does it matter when they retired?
Correct, correct.
Okay.
Now, again, if they're over age 65, they're going to be a part of that Aetna Medicare Advantage program. So that's totally separate. And when a retiree who's under age 65 turns 65, they're going to ostensibly move out of this educators plan and go into that Medicare Advantage program.
Great, thank you.
Sure.
Alrighty, no other questions from online board members. Let's go to the board table. We'll start to the left. Mrs. Von Aiken.
Thank you. Thank you, Ryan. That was a wonderful presentation. Comparing to what the district has now as their plan, how does the cost to the district, what's the difference in change to the costs?
So we're working all of that out now. There's two different pieces that we have to look at here. There's how much is the premium lower in this new plan in comparison to what you offer? And even that's a little bit of a tricky question because you offer 3 or 4 different plans. You have a PPO, you have a direct access, and you have a point of service for the custodians as well, along with different variants of those PPOs and direct accesses per union. So there's different numbers that are floating around because the educators plan will be one price and it's going to be in comparison to 7 or 8 different sets of rates that are out there. So we've got the rates in, we're processing all those different pieces. And the other piece that we're looking at, of course, is we've built a contribution calculator and we're uploading your information into it to determine what the contribution loss is going to be to the district as a result of those that enroll in this new plan. I can tell you that this new table based on percentage of salary, in 99.9% of the instances, those that move to this plan and pay on percentage of salary will be contributing less to the plan than they were prior. And the amounts will vary based on their salary and based on their enrollment level, and also based on what plan they're coming out of. But there will be a decrease in the contribution receivables to the district.
Okay, but is the anticipation that the premium will also be lower?
The premium will also be lower, but to tell you whether there's savings there yet, or if it's going to be actually costing more yet or not, we're finishing all of that up literally in the next day or two. So we're going to have that all sent over to the board office once we've got our contribution calculator QC checked, verified, to make sure we see where the spreads are.
Perfect. Thank you so much.
Anyone else at the board table? Mr.
Sure.
Chaffo.
Ryan, thank you for the presentation. As always, very thorough. More comments and questions. So just doing the math, someone making $80,000 electing family coverage would be paying about $4,400 a year, or $367 per employee per month. And the benefits are, from a private sector perspective, extremely rich for that employee contribution price point. So I'll just make a judgment, again, a travesty to taxpayers that this plan exists. You know, I'm not sure what else to say. Am I correct on the prescription drugs that a specialty formulary, let's say for a Hep C product that could be $10,000 a month, it's only at the brand or generic copay?
So you're correct. You're correct that the plan will have a $5 generic or $10 brand copay. However, there is step therapy in those programs where not all drugs, the way your programs are set up now, most of your drugs are at $15 or $45, I believe the copay is for
Right.
this group. And everything's on an open formulary at that point. While these copays are lower, there's a greater level of restriction in the plan insofar as what medications are going to be allowed to be prescribed first shot right out of the gate. With step therapy, certain drugs are going to be classified as you have to try drug X and drug Y before you get to try drug Z, because drug Z is so expensive, or whatever the case may be, or X and Y are just as, you know, the efficacy of those drugs are the same. So you have to try those first. And then if they don't work, you're going to, you know, have access to that drug Z that is on. So there are a lot of differences, and it's very important that they're outlined in that. I would also say that as these numbers start to come in, the savings versus plans it's looking challenging in the sense of what the savings in premium is versus the reduction in contribution is coming in at. So we're starting to see it in some other districts. We're finding it even more difficult in areas where there's been a lot of working with the union and negotiating on plan designs. And now this comes in, and while it may be considerably cheaper than a direct 10 program that the school employees benefit has, districts that have plans that, you know, have been negotiated at a level that aren't at the same level as a direct 10, the rate spread is not as large. So that's where we're seeing some difficulty here. So we're in the process of punching it through and seeing what this means. But I've seen it in other places where it's been very difficult, very difficult.
So difficult means it's more expensive to taxpayers. Just say that. That's fine. We can understand that language.
Yeah.
Okay. Thank you.
I was muted. Mrs. Cogan, you good?
No, I do have a question.
Okay.
Actually, just two. You said the current employees can opt into, you know, this new plan, even if they were hired before January or July 1st. Do they have the option of getting back out at another open enrollment period, or are they stuck in until 2028, like the new hires?
So that's a great question. I should have actually addressed that in the presentation. Great question. The answer is, if you were hired prior to July 1, 2020, this plan option is a plan option for you at any time to go in or to go out of at any given open enrollment. So as an example, if there are 3 plans offered to the staff at this point, this is simply just a 4th plan you could take and then jump back out of the next July 1 open enrollment. The key point to mention, though, is, again, once you're in for the next open enrollment. So if you go in now, come July 1, you can go back out during the June open enrollment if you don't like it or whatever. And vice versa, if you don't want to do it just yet and you want to wait 6 months after everyone else is in it to see how it is, this coming July 1, you can go into it. At that point in time, it would be the following July 1 of 2022, of which you can go back out of it or go into it or whatever you would want to do. It's only the new hires after July 1 that are mandatorily going to have to stay in it or choose that new Garden State plan if they want to pay even less in contribution. They have those 2 choices as their option, and they'll have to be in one of those 2 choices until 2028. And it's not a running 7 years. I want to point that out too. So a teacher you hire in 2027 only has to stay in it for that 1 year, at least the way the law is written right now and the way we're being told to be administered.
Okay. And then my other question, I'm not quite even sure how to word this, but I'm just going to ask it. When you're giving the presentations to the staff, are you making clear that you're trying to educate them versus steering them into a specific plan or not into a specific plan? Like, your role there is not anything to do with the board or finances. It's really to educate the staff on their choices and how to make their choices.
That's correct. We wouldn't steer or guide them into any certain plan or to stay or to go into any certain plan. We're there simply to make sure they understand what they have now, what they're paying for now, and what they have as an option and what they would pay for that option, and to know as many of the nuances that we can share with them so that they can make an informed decision based on the way that they utilize their health care and the providers that they utilize.